Hey guys, so I'm making myself do this because I keep slacking on it. Week after week, I keep slacking. And here I am. I am 29 weeks. I don't know what the last one I did was. It was either 26 or 27 weeks. The last update I did. And right now, well, I've done a couple others, but I prefer to use a tripod. My tripod's technically over there. You can kind of see it leaning against the thing, upside down. But if you watch my last, well, not my last video, or not my last update video, but one of my last other videos, vlogs that I did, I have a clip in the beginning where I talked about and kind of showed Xena bent it all up. So we have another one somewhere. I haven't really looked for it, but as of right now, I pretty much don't have one. So that's kind of the case right now. So skipping ahead to this week, week 29. What is going on with my leg? You guys see that? Right there. I don't even know. So in week 29, symptoms. Hopefully you guys can see me okay. I don't have the light on. I'm in the office and I don't have the light on. It's light outside. Kind of rainy, but anyway. And Xena's in here. So if you hear weird noises, it's probably her. Because she's crazy. She just likes to roll around and make weird noises. But anyway, yeah, symptoms. I don't think there's anything super new symptom-wise. I have been feeling her move around a lot. And instead of like, Xena, down. Xena. Instead of just like kicks, I have, since my last update, especially in the last week, I felt more of like just movement, just kind of like, not like, I don't know, quick kick type things, but kind of like, more like this rather than this, if that makes sense. Like not fast kicks where it's like, oh, she's kicking. It's more like, oh, that feels weird because it like just feels like she's pushing out from the inside. Or like leaning against my belly or something. So that's kind of a different thing. It doesn't hurt at all, and it's not bad, but it's just kind of weird and kind of different. Xena's sniffing my leg. Hi, puppy. Oh, goodness. So that's been going on. Also, I don't know if you call it a symptom. She's being weird. Why are you sniffing my foot? She had her nose like right up on my foot and just like being weird. She didn't do that. Anyway, yeah, another thing, is not, like I said, it's not really a symptom, but, like a, I don't know, like side effect-ish, or like, effect of, side effect or just effect of my belly getting big. And I'll show you a bump shot probably in the bathroom mirror, at the end of this video, or like, at the end, yeah, at the end of this update. But my belly is getting bigger, and so like if I'm sitting down, or really even if I'm standing like today at work, but if I'm sitting down and I go to like lean down to pick up something off the floor, then it's like, oh, it like hurts my belly. It's like, oh, I can't do that. I don't know if it's pain, just kind of like, I don't know, like takes the breath out of me or something. It just is uncomfortable, so I can't do that really. Or if I'm like, or if Xena's at a place where I'm sitting and I have to reach to pet her, like lean and reach forward, that's kind of the same thing. I just can't really do that anymore. It's starting to push on my belly and stuff and just be like, so that, and then kind of leaning over and stuff at work. Oh, you just slobbered on my toe. This dog. She's not doing anything bad. She's just affecting me. So really that's the only stuff. I haven't felt sick. Oh, I did have, and I didn't update you about it. I had my glucose test, which I might put in, yeah, I'll put in a clip, right here. after. I'll put in a little clip right here of when I was drinking the glucose and tell you how that tasted, because I was a little worried about that. So I took that, and they took my blood, and the next day they called, and I do not have, or as far as I know, they didn't say that I did, so I'm guessing that I don't have gestational diabetes, which is great. I have a friend that recently, earlier this year, I think, maybe, or last year, I don't remember. She recently had, he's less than a year old, but she recently had a little boy, and her biggest fear during her pregnancy was getting gestational diabetes, and she ended up getting it, unfortunately for her, and she was really upset about it. I didn't talk to her much, but we were going to hang out one time, some friends of ours, like me and some friends, and that friend didn't end up hanging out with us because she was kind of upset and stuff from that. But I haven't really thought much about it throughout my pregnancy up until that. And I wasn't super worried that I would have it. I'm not, I don't know, overweight. When I drank the stuff, it didn't really have much effect on me. It didn't taste bad. It definitely did make me sick type thing, and it didn't feel like it was too sugary. And it was fine. But as far as I know, I don't have it. They didn't say that I have it, so I'm guessing that I don't. But my iron is low, which they've been telling me for the last few appointments. And I think, is it today? No. I think yesterday. My days are getting all mixed up. Like, it feels like Wednesday, but it feels like Monday. I don't know. But it's Tuesday, by the way. And I turned 29 weeks this past Friday. So anyway, because my iron is low, they gave me this pill, or some pills, that I have to take once every other day. And because I only have to take them every other day, it's easy, and I only have to take them one time a day, it's easy to forget. And so I got them last Tuesday, because I had my appointment last Monday. I got them last Tuesday, took the first one Wednesday, and then forgot to take one until Saturday. So I didn't take one. I was supposed to take one Friday, and then Saturday, or no. Maybe I took it Tuesday. And I was supposed to take it Thursday and then Friday and took it Saturday or something. I think I missed like 2 days. I should have taken it. But then I took it yesterday. So I'll take it tomorrow. But I had no problem taking it. I talked to my sister and my mom about it. And my sister said she had to take them, but they made her sick. They don't have any effect on me. I mean, it says to eat them or to take it on an empty stomach. And I have both times. I listened to what it said. I don't know what my sister did when she had to take it, but I took it on an empty stomach and then like ate not long afterwards. But it hasn't affected me badly. I know I really probably should take it. And it's not that I don't want to take it, it's just it's easy to forget to take because I haven't been taking any pills, and because you only take it once every other day. And so it's not something you really get in the habit of taking at the same time, like every day or whatever, because it's every other day. So I have to take that, but I've been feeling fine. I haven't had a whole lot of pain. There is kind of like after work or whatever, aside from the leaning down and stuff sometimes, or like leaning over at work sometimes, there have been sometimes, or have been like days that when I get off work, before, like when they first started giving me the 8 hours type thing, like the 5 to 1 shifts, I would get off work and my feet would hurt by the time I got off work. And the last week or two, maybe, at least last week that I've worked, I haven't worked as many 5 to 1 shifts, but I worked about as long most days that I've worked, and my feet haven't hurt as much, but like today, for instance, my hips kind of hurt a little bit. I guess I don't know if I noticed it at work, but when I was like when I got home, I kind of noticed that I was walking inside, and I kind of noticed my hips hurt a little bit, and not super painful, but it's noticeable. So I think it's kind of switching to like, because of my belly and stuff, my hips are kind of taking, if I walk around for a long time or if I'm on my feet for a long time, then it starts to affect my hips. So there's that. Those are kind of the symptoms. Also this week, it says the baby, Quinn, is the size of a Barbie car. How did it word it? How did it word it? How did it word it? That's what I'm trying to find out. A Barbie convertible. It says Gwen is now about the size of a Barbie convertible. And then the cheesy thing that it always says, it says she can't wait to drop the top and feel the wind on that little face. Even when she's born, I don't think she'll fit in a Barbie convertible. But, you know. Let's see what I haven't even read this yet because I was waiting until I did the video. Gwen's movements are getting less violent and more regular as she grows to the bounds of your wounds. Of your womb, not wounds. Of your womb. She's still moving more and more every day, but getting near to the point the next few weeks where her movements will reach the level they'll be at for the rest of your pregnancy and stop increasing. Your growing womb and the pressure it can put on your abdomen means you might experience acid indigestion, which I haven't so far. Levels of estrogen aren't helping. You might still be experiencing constipation. Haven't really had that problem in a while. Gwen is about 16 inches. I should stop rocking, sorry. Tall and the size of a pineapple or a Barbie convertible. And pretty close to birth height. She's still weighing in at almost 3 pounds. So she has a lot of fat to pack on in the next 11 weeks. Her muscles and lungs continue to mature. She still has plenty of weight to gain. She'll be kicking it up and moving around the womb. How am I? How's mom? My body's releasing hormones that relax my muscles, muscle tissue in preparation for delivering her. I can slow my digestion. Says there's things I can do to fix that if that becomes a problem. I should let my healthcare provider know if that becomes a problem. Varicose veins could happen. I'm supposed to eat a lot of fiber. Oh, also when they prescribe me the pills, what is it here? Prescribed me the pills. I said to eat a lot of foods that are rich in iron too. Make sure I do that. Iron-rich foods. Give myself a lot of rest. Avoid headache triggered by tension or dehydration before they start. Be prepared. She's going to be packing on some serious pounds in the coming weeks, and so will I. I'm getting into the home stretch. And it has this little picture of a baby. I don't know if you can see it. Yeah, I guess you can. And while we're looking at that, there's the convertible. And then her hand and feet. Hands right now. And the feet compared to how they will be. Can you see? Yeah. So that's that. I think that's pretty much everything. I still have, as like a little side note, I still have my hemorrhoid that I've had for weeks. I've had since like early May, like the first weekend in May. I think it was when I got that, around that time, a little before maybe. And June, July, it's been like 3 months and I still have it. It hasn't hurt since that weekend. I haven't had any pain. But I'm still putting the stuff on every day, once or twice. I usually try to put it on before I go to bed and when I get up in the morning, or at least one of those 2 times. So yeah, that's still a thing, which is annoying, but it doesn't hurt or anything. It's just annoying that it's there. And I'm kind of getting used to it, of course, but it's still annoying. But it doesn't hurt or itch or anything like that. That's not a problem. But I think that's it. I told you about my glucose test. I'm after this last appointment I had on the 13th. It's now the 21st, but the last appointment I had was last Monday, the 13th, and that was my last appointment. That was like 4 weeks between appointments, like once every month. Now, starting this, like, between that appointment and this next appointment that I have on the 30th, it's going to be every 2 weeks. And then, of course, it'll go down to 1 week. But, you know, it's getting closer. Oh, I want to show you, maybe in the next update, I will show you the nursery or when it's done. Because right now, Brett's done some stuff to it and it looks nice. But it's kind of a mess because I have to find a place for the clothes. And I don't know if it'll be truly ready until after the baby showers, which are, one of them is in September and I think the other one's going to be in October. My family's doing one, well, my family and his family, and then my pastor's wife, Erica, wanted to throw one at the church for like church people and stuff. She would like to throw one, so that's going to be the one in October if that's when she ends up having it. So there's that, and there's Popo. And I'll see you in my next update. Oh, let's go look at the belly shot. I was going to do a separate clip, but I don't feel like it. So, let's do this. Stay. Alright, guys. It's definitely, there we go, is that better? It's definitely gotten bigger. So, there's from the front. I'm wearing, oh, by the way, this dress that I'm wearing, it's a nightgown that I got, and it's like a nursing nightgown, and it has like these little pretty things here, and it's pregnancy / nursing thing. But there's my belly, put that on my tiptoes, and there's the side. Let's see if I can zoom in. It's hard to see. There's the side. I don't know if that's better or worse. Is that better? There. There's my belly. The side. Papa's making. There's the front. And our things kind of, our mirror's kind of dirty. There's that. Alright. I will see you guys in my next update video. See ya. Hi guys. First of all, Popo. She's shaky and tail waggy and kind of sad. I mean, wagging their tail usually means they're happy. She's happy because she sees me, but she's sad because she's in her cage. And she's in her cage, not because she's in trouble, but because I'm not really home for very long. I got off at 3 today, and I have an appointment at 4:40, and I'm not looking forward to this because I've heard that it's not good, and I don't know. But I have to take my glucose tolerance thing today, which means I have to drink. It seems pretty watery, like it doesn't seem super thick, but I have to drink this Easy Dex. I don't even want to read anything on it. Anyway, I have to drink this. It's supposed to taste like orange. Oral glucose tolerance beverage. But I'm going to show you guys. I watch a lot of people on YouTube. Well, I watch a couple now. One of them just had the baby, but a couple people, I've watched a decent number, at least a handful of people on YouTube who have been pregnant and go through their pregnancy and like give updates and stuff. But none of them have, and I'm sure I'm not the first person ever, but none of the people I've watched have shown themselves doing this. So I'm going to, not because of that, I guess, but hold on, let me put this up a little bit. I'm going to grab it in a minute, but I gotta open this up. So I'm going to, so I have to drink this. Oh my gosh. That's so gross. You see that stuff around the edges? Ew, gross. Can I get that off there? Ew. It's like so much sugar. So my rules today are the rules for the day, or for like this situation, were that, oh, and I have to take it. It's officially a half hour before my appointment. But the rules were that, well, it said that I had to eat normal for the 3 days prior, which I eat normal like always, so I hadn't even thought to do any differently. I can't have anything super sugary today. So really all I've had is 2 pieces of toast with butter, I've had 2 glasses of water, one before work and one after work, and I had a bag of chips, like a little bag of chips, because I'm afraid to even eat like supper, because I'm afraid, because like these leftovers I have like barbecue sauce on them, and that's technically kind of sweet. I don't know how sweet is too sweet, so I don't want to do this. I don't want to do it on camera. Oh, it smells good. Maybe it won't be too bad. It actually smells like the orange stuff. Fanta, by the way. I wouldn't say, this isn't Fanta, but I wouldn't say it's a, what's the word, craving, but it's like my favorite drink, my drink of choice now that I'm pregnant and can't have caffeine. So I drink this within 2 to 3 minutes, so I probably won't show you me drinking all of it, but I'm gonna see it. Oh yeah, that's not bad at all. It tastes like juice, like orange juice. Like, not orange juice, but like orange flavored juice. It's actually pretty good. I was made to believe from, I don't know, from different things that I heard, I don't even know where I heard it, but that it was really gross. And it's really not that bad. The lady said it tasted like flat orange soda. I would say it tastes better than flat orange soda, but it tastes like the cheap orange drink you get, like orange fruit drink or whatever. I'm trying to drink it fast, just to get it over with. Oh, that's nice. What I said was nice. I said that some patients may experience one or more of the following problems: nausea, vomiting, diarrhea, or fainting. That's something to look forward to. All done. I tried to drink it fast in case it ended up being worse tasting than the more I drank it. It said to drink within 2 to 3 minutes. About 2 minutes. I finished at 4:13. Is that right? We'll say 4:13. It was close enough. That says 4:12. That says 4:13. And this says 4:14. We'll say it's 4:13. Somewhere in the middle. That's the one I was watching. So I finished it at 4:13. I have an appointment at 4:40, and I'm not allowed to eat or drink anything between now and my appointment. So there's that. It really wasn't that bad. Yeah, I'd rather be worried and have it not be bad than not be worried and have it be like super gross. I love you, puppy. So now that I drink that really fast, my stomach is a little, not uneasy, but a little like, whoa, what'd you just do? What'd you just do?